onset of various cardiovascular insults in the form of fatal or non-fatal myocardial infarction, fatal or non-fatal stroke, fatal or non-fatal heart failure, including sudden cardiac death. There are several triggering factors. You know that the hypertension is the major contributor. It contributes almost 40 to 50% of various cardiovascular related disease morbidity mortality, which might be the heart related, maybe renal related, maybe cerebral related. So the hypertension, apart from the diabetes, mellitus, dyslipidemia, obesity, lack of physical activity, and lack of sleep. All these factors are often in combination contributing, but the major triggering factor is the hypertension. The hypertension plays an important role. The crucial, the critical factor that contributing to the greater proportion of various life-threatening luminous cardiovascular events, the insults in form of fatal or non-fatal myocardial infarction, fatal or non-fatal heart failure, acute renal failure, intracerebral hemorrhage, so on and so forth. So, you know that the hypertension, particularly the hypertensive crisis, is often encountered in emergency arena like ER and MICU or ICU, wherever. The hypertensive crisis is often attributed to the great proportion of morbidity and mortality pertaining to the cardiovascular diseases and including the renal events and even in pregnancy. So the hypertensive crisis means the definition of the hypertensive crisis. You all know that the systolic blood pressure exists beyond 180 millimeters mercury and the diastolic blood pressure more than 120 millimeters mercury is either with or without any target organ inflicts or target organ damage. This is the major the observation about the hypertensive crisis. It is again of two categories. One is the hypertensive emergency, and the second category is the hypertensive urgency. So in the former category, there is the hypertensive emergencies where the systolic blood pressure more than 180 coupled with the diastolic blood pressure more than 120 coupled with the target organ damage. So the hypertensive crisis with the target organ damage we often christened or designated as a hypertensive emergency. Second category is the hypertensive urgency, wherein the hypertensive crisis is systolic blood pressure more than 120, the diastolic blood pressure more than 120, the systolic blood pressure more than 180, coupled with absence of target organ. This is called hypertensive urgency. There are several molecules being utilized or employing in the management, the diagnosis. You know that there are several molecules nowadays we've been employing for the management of hypertensive crisis, which might be hypertensive emergency or hypertensive urgency. Of which the most important molecule earlier we were using sodium nitroprusside. Other molecules include phentolamine and phenoldiazepam, enalaprilat and labetalol, and the recent entry, the new entrant is the hydrol. That is new entry in the management of hypertensive crisis, particularly hypertensive emergency. So the hypertensive emergencies are always to be treated with parenteral medications, whether intravenous or intramuscular, whereas hypertensive urgency to be treated as well as possible with oral antihypertensive medications. So we discussing about the hydrolysine. It's a very brief talk. Before ball rolling on to the current talk on a molecule, the hydrolysine, I would like to unfold certain important issues pertaining to hypertension, particularly which is very prevalent in our country. Uncontrolled hypertension, uncontrolled blood pressure is a major risk factor, is a major triggering factor contributing to the major cardiovascular insults in the form of coronary events and coronary insults in the form of fatal or non-fatal myocardial infarction, fatal or non-fatal stroke, fatal or non-fatal heart failure, and even sudden cardiac death and heart failure, edema, hypertensive, encephalopathy, intracerebral hemorrhage, subarachnoid hemorrhage, and acute kidney injury, and eclampsia, and its nefarious complications. These are all contributed by the uncontrolled or inadequately controlled and inadequately optimized blood pressure with appropriate antihypertensive medications. If we look at very carefully, the prevalence of hypertensive crisis in our country is around 30%. The prevalence is very high. One out of every third person is suffering from the hypertension. Again, 22 crores of population, 220 million population are suffering from hypertensive crisis across the country. So the uncontrolled hypertension, as I stated earlier, means the systolic blood pressure more than 180, the diastolic blood pressure more than 120, with or without target organ involvement or the target organ damage. If the target organ is affected, either kidney, heart, or the brain, if target organ is affected, that we call it as, we often refer it as hypertensive emergency. So in our country, as I told you earlier, the 1 to 2% of the hypertension patients may develop hypertensive crisis in their lifetime. So this is, as I told you, hypertensive crisis is of two categories. One is the hypertensive emergency and urgency. In the former category, you can witness target organ damage. In the latter category, there is no target organ damage. This is according to one small study, Indian study, which